lucky to have with us just another group that is really leading the charge when it comes to delivering virtual in a newly virtualized healthcare system in this new endemic America that we're living in. And again, I couldn't be prouder. Both former students of mine from Columbia, Dr. Eliza Eng and Dr. Shailja Dixit. Thank you both for joining us today to talk about Curio and all the good stuff that you guys are doing there. Welcome to the program.
Thank you, Stan. Thanks for inviting us here. This is Shailja. Really grateful to be here.
Great, great, great. And let's just start off with like a 1-minute background so the audience can get to know you a little bit. First, tell us a little your 1-minute background and tell us where you're hanging out these days, which part of the country you're sheltering in.
Great. Absolutely. So I'm Shailja Dixit. I'll start with the easier thing. I'm based in Princeton, New Jersey, so East Coast in US. I actually, as Stan said, I am a former student at Columbia. Stan was a professor when I was doing MPH at Columbia. And that's where I met Eliza, and she'll talk about her journey. I'm a physician by training, have my master's in informatics and then MPH from Columbia University, have been engaged with HIT Lab over the course of many years, 15 plus years actually, ever since I graduated. I've spent time in life sciences, leading medical affairs and health outcomes teams. And 3 years back, we started our journey, which we'll talk a little bit more about, Curio, which is solely focused on women's mental health. So it was really nice to see all of the discussions before us. I think it sets a very nice stage to what we are going to talk. Eliza?
Absolutely. Eliza.
Hi, and good afternoon or good morning, depending on where you are. I'm Eliza Eng. I am an OBGYN by training. And my career trajectory is diverse, if you may. I've had worked in multiple settings: academic medicine, Columbia, for instance, pharma, payer, and integrated delivery network. And my expertise is in population health, clinical innovation, and clinical transformation. Even though my area of purview or responsibility spans the population across continuum of care, across multiple therapeutic areas, because of an OBGYN, women's health has always been, my passion. And so when Shailja came to me over a year ago with this concept of really delivering digital health to women, I jumped at the opportunity because I firsthand, as a consumer or payer in some ways of healthcare, I realized that there's a huge unmet need in that space.
That's fantastic. And, Shailja, maybe you can give us a background on Curio, where it came from and some of what it's meant to do.
Sure. Again, thanks. Thank you so much, Stan. You have been actually part of the journey, HIT Lab, through Curio's inception. So 3 years back, we started putting together this concept of beyond the pill, right? So I come from the life sciences, and over it's very clear. I've spent a lot of time. I was listening to Dr. David Carr at Sanofi, leading health outcomes team at diabetes division. So it was very clear that you have to think. Definitely medication and innovation has a huge part, but you need to complete this circle with a beyond the pill concept. And as we started developing our beyond the pill digital space, the area that we identified where we can have an impact, and there is a big unmet need from a population perspective as women's health. And then we further zeroed down on, and it is more relevant actually in today's context. We'll talk more about that, on women's health, mental health. So we all know that, women don't keep their health in the center, specifically mental health. There are a lot of access and stigma associated with that. And that's what we aspire to deliver through our digital platform. We call it circle of life. What it means is that every aspect of women's journey throughout their circle of life has a unique challenge, but there are underlying things which are common and the themes that are common across our women population. And that's what we plan to address through our digital platform. So it is a digital therapeutic platform. So we are seeking like FDA Class 2 device approval and deliver intervention for a specific indication through our platform. The first few indications are postpartum depression, and then we have a pipeline of other indications that we are looking at.
That's fantastic. And Eliza, tell us a little bit about the platform and what you're seeing here as a response to some of the health outcomes and the disparity in health outcomes for gender and sexual minorities that we see here. Go into the mission really around Curio and that effort.
Sure. Let me set the stage and the background, because I think it's not only important, right? That's our mission. It's complicated, but yet it's just very simple as well. There's a gender gap in mental health. More women in this country have mental health conditions across almost all conditions except substance use disorder. Yet, because of a whole host of barriers, women tend to have poor mental health outcomes. But why, right? Why would that be in a gender perspective? So multiple reasons. Number one is the fact that we just don't have enough providers in general in this country. It takes in New York State or New York City per se 60 to 90 days for an insured beneficiary to get to see a new healthcare providers in mental health. The U.S. on average has 30 psychologists per 100,000 population and 15 psychiatrists for 100,000 population. You don't need to, get A's in your math class in high school to know that that's not enough. Now, that of course is across the board. There wouldn't be contributor to a gender gap per se. More importantly, there's social and environmental factors, as well as the way that care is delivered in the system in this country that contributes to the gender gap. So I'll start with the social and environmental barriers. Poverty. Women are more likely to live below poverty line than men. 14% of women in this country live below poverty line versus 11%. They're more likely to be underinsured or uninsured. They're more likely to be exposed to violence and assaults. They're more likely to be single parent. They're more likely to work more than one jobs. These are all risk factors as well as barriers, right, to access to care. And women bears these risk factors, unfortunately, more than men. And in addition, there's this whole notion of legacy healthcare systems that is really not set up well to take care of women's need. Number one, physical health and mental health are completely separate, right? From the way medical education is delivered, the way training is delivered, and to the way that facilities are configured, right? You have a physical health hospital, and then you have your, mental health facilities. And in many countries are operated by the state. And even the way we pay for these services are separate. I don't know if the audience know that. Again, in many states, including New York, for instance, where we live, mental health and physical health are managed and paid for by two separate state agencies. They don't cross. So these separation has huge impact. And yet, when you look at it from a person perspective, physical and mental health are intricately related, right, for the person. In addition, many people, right, don't identify themselves and don't seek care with behavioral health providers. In some of our surveys that we've done, as much as 30 to 50% of women identified their OBs as their primary care. And so, needless to say, our healthcare system is not set up. We're not trained. We're not trained to screen. Nor we're incentivized to perform mental health services as physical health providers, for instance. And it contributes to the unmet needs. And lastly, there are mental health disorders that are pretty unique to women, mainly in the realm of depression, where they're very much tied to hormonal changes. So there include post-menstrual dysphoric syndrome, disorder, postpartum depression, perimenopausal depression. These have a physiological basis to the conditions, and yet these are traditionally very much underfunded research and thus not very well understood. We have yet, as a society, much to learn about the physiology, biology, genetics, as well as the treatment of these conditions. So all these factors contribute to the fact that women's mental health there's a big gap, and that contributes to the poor health outcomes.
Yeah, that's an amazing overview of it too. I've been studying this and really reading up on this now for most of my career over the last years of teaching and research, and you just gave it a great 5-minute synopsis. Thank you, Eliza, for doing that. And Shailja, talk about the mission of Curio and talk about the mission aligning with addressing those disparities and how the platform is going to address that.
Yeah. So, Eliza talked about really nicely about the background and unmet need. We took on a lot of these things as what we call guiding principles or mission of Curio. One and foremost is integrating the care within the delivery system. So that's a really big piece of the work that we have done. So making sure that digital is an extension of the care that's given today rather than creating a parallel system, right? That's really important. Again, we both are also clinicians by background, making sure that you keep the healthcare team also engaged in this journey as you are thinking about delivering that care. That has been one paramount important thing. The second important aspect and mission is to make sure that this access is provided, right? We talked about how access is a challenge. So we are making sure that it's super simple. We talked, I think Dr. David Carr was talking about internet. We are not expecting that, everybody will have like a browser, will have like a digital application that they can download. So it's a simple way of delivering. Of course, internet is needed, unfortunately, even in our platform, but it's a very simple from a technology perspective. That's our second principle, right? Making sure that access is delivered. Another important component is, as Eliza was pointing out, that there are not many mental health providers that are available, right? One is integration. We talked about integration. Second is the lack of right mental health services. They're not existing. So our platform actually provides a tool where, you can actually stratify the population. A caregiver team can stratify the population and can actually target those who need the help at the highest category. So it's also takes care of the access approach, right? That's another important thing. The third mission and the guiding principle is that we want to make sure that our content that we are delivering, the intervention that we are delivering, is as personalized as possible, right? Yet evidence-driven, right? So intervention is based on a lot of studies that we have already conducted, the studies that we are planning to conduct, and more studies that we want to do in future as well, very near future. So one is evidence-driven, but yet, so there is a standardization based on evidence, but standardization does not mean that there is no personalization, right? So there has to be a perfect balance of standardization and personalization. So we have an adaptive learning management system on the background, which provides intervention and meets the patient where they are, because we believe that one silver bullet does not fit everyone. It has to be customized to this extent so that the woman and the patient is as engaged as possible. I also want to just acknowledge this up front. It's a journey, right? I'm not saying that we have answers and we have got it so hyper personalized that we can answer each and every question. It takes a while, and it takes a while to collect the right kind of data and evidence to understand that. Understanding the patient journey, understanding the social determinants, it takes a while. So probably we have started our journey towards that. Our hope is that over the course of years, we'll keep on refining it and making it even better and better as time goes. So while I'm saying that it's standardization and personalization, I don't want to give an impression that we have figure it out and have answers to each and everything. This is a complex situation where we have to take a step-by-step approach. So that's where our approach is. We are in process of launching our product. As you know very well, we have been very nicely collaborating with Health Innovation Technology Lab, to conduct some of the human factor study. This is an integral part of understanding the population. So our first step is to test what we have made with human factor testing, and we are doing it in collaboration with HitLab with a fairly big population here. So.
Yeah, and seriously, congratulations on that too. We're really happy to be collaborating with you and conducting that research with you all. Eliza, going back to you on this, what are some of the new trends and developments that have been happening where this is kind of like almost like a perfect storm for what Curio is doing? I mean, it's really sad that given the tragedy going on globally with the pandemic, but there is a bigger need for Curio now than ever, aside from the disparities that we're seeing. And now moving into this virtual first, talk about this virtual first healthcare trend and how Curio is really coming to the rescue in a lot of ways to meet these really exacerbating disparities now.
Yeah, so there's a lot to unpack here, and I would say that I'll address the trends from an public awareness perspective first, clinical perspective, and policy perspective. And perhaps Shailja also will talk about from a technology perspective. And I think the guiding principles of what we're doing here with Curio is that we understand these trends. And so what we're developing here really encompasses all the spirits and the principles behind and the logistics behind these trends. To her point, our goal is to integrate our solutions into the bigger ecosystem, right? It can't sit alone outside. It's not a direct-to-consumer product. It is really something that we want to get the hands on our providers and our patients and our other stakeholders so that we can really leverage that. So in terms of trends, I do think let's talk about public awareness, because that's really important, right? Without the public and without everybody's buy-in to the need of this, nothing is going to be as successful as it should be or could be. We are more aware as public and as well as the medical community in terms of accepting the intersectionality between physical health and mental health. So, for instance, in the area of maternal depression, 5 to 10 years ago, the whole notion of maternal death or this sort of rising rate of maternal death in this country has started to surface. And a lot of efforts, resources, initiatives have been focusing on addressing the physical health component, right? How to train doctors and the hospital system to really, be ready for a maternal emergency with hemorrhage, which is a large blood loss situation. But nowadays, we're really hearing more about the conversion of, the fact that 40% of maternal deaths have been either directly or indirectly related to maternal mental health, sparks the interest and the acceptance of the fact that we got to go more upstream. We got to go and address the fact that the preponderance of sequelae is related to mental health. So one example is that if a woman has high blood pressure, right? Someone who's pregnant has high blood pressure, but she's depressed. She's not taking her blood pressure medication. She shows up at delivery, her blood pressure escalated, and she developed eclampsia and suffered a major complication. That, yes, is a physical health issue, but it has a huge mental or behavioral health impact. So the public awareness is really important. And on the clinical side or the delivery side, there are a couple of trends, right? It's always, and the threat is about meeting patients or individuals where they're at. There are new fields in psychiatry and psychology that addresses the unique women's mental health needs. They're called reproductive psychiatry. There are new types of providers that are available, and insurance actually covers them now. Doulas, midwives. There are new ways of delivering care. This whole notion of group visits for maternity care is holding a lot of promise from an evidence perspective in terms of improving outcomes. And there's also a new clinical paradigm and looking at what maternity care should be. The whole concept, right, is a new concept of fourth trimester. It actually acknowledges that pregnancy care must go beyond the the traditional achieving the outcomes of a healthy baby and a healthy pregnancy, right? We need a comprehensive approach to actually address the physical, social, and psychosocial well-being of the mother, which then means we have to look at the woman holistically, comprehensively, integrating both physical and mental health in the postpartum care period in order to address maternal depression. Now, at the policy level, we're also seeing changes. So we're seeing statutory changes in many states like California and Texas, where they're extending the Medicaid coverage to those eligible beyond the general 60 days coverage to a year after post-delivery, because they realize that it doesn't serve the woman's well if you're only covering the woman for 60 days postpartum. Meanwhile, her postpartum needs are much beyond those 60 days time frame. There are a lot more bills at the federal level and the state levels that we're going to see coming down the pike to address similar intent.
I think that's exactly right. And, I think one of the things that we talk about during the prep for this panel is talking about the innovation here and how Curio isn't just a digital therapeutic, but it's really this innovation factory that looks to innovate in this area now for many years to come. Shailja, talk to us about that, about the potential that this kind of innovation has, not only as a point solution, but as a platform, and where this is going to grow over the next several years.
Yeah, so thank you, Stan. And, it was very interesting. One of the panelists before talked about brick and click, right? I really like that term, again, as Eliza is saying, although we are seeing a lot of policy changes, awareness, we believe, and we started working on Curio before pandemic, right? Pandemic has definitely highlighted and how big this problem is, and it made it even more spotlight on mental health and mental health in women. So our platform, which we plan to extend exactly beyond the four walls of clinic. We don't want to stop only on postpartum depression. That's one segment we are starting with, understanding that here is where the highest unmet need is, but these kind of platform can actually help women to not just take care of their mental health by providing specific interventions, having outreach with their mental health professional, also their caregiver team, making sure that, when they can access care, mental health care specifically, in the comfort of their home. So destigmatizing, right? Stigma, we know, is a very, very big thing in mental health, and more so in women's health. It will also be surprising, Stan, I've been talking to some of the healthcare systems, some of the experts across the globe, what are the commonalities across every culture, right? So there are things which are different, of course, but there are things which are so common across the culture. And one thing which is common across all the culture, all socioeconomic strata, is stigma. So we believe that having a platform like this also makes sure that there is no stigma attached to mental health, right? We, the way we have made our platform is, the first thing is acknowledging that this is okay. I mean, there are others who are like this. This is a normal process, and many, many women suffered through this. You are not alone, right? So making sure there is an empathy factor affiliated with that, which is appropriate for the patient, for the woman, and making sure they have access at their time. Another very big thing is that in our platform, we have created this bite-size intervention. So all the intervention is not given at one time. We understand that for engagement, you need to have personalized bite-size engagement. So that's another aspect in our innovation that we have created. We are integrating a lot of chatbots, AI, a lot of learning management system adoption. So I think the only better is going to come, and we are hoping this platform will address postpartum depression. We want to go into perimenopause, menopausal mood swings, contraception and mood disorders associated with that. So we are planning to cover actually every aspect of women's health as they go through what we call cycle of life. That's our mission and vision, and hopefully we can reach out to larger population one day and make this dream come true, that more and more women talk about mental health and access such tools.
That's fantastic. Well, thank you both for joining us here today. Just an incredibly perfectly timed digital therapeutic to join the global healthcare ecosystem. Thank you both for joining us.